If you suffer with sciatica, the next 5 minutes may be the most important 5 minutes of your life. If you want to get back to sleeping at night, you want to get back to where you can use that leg without pain, and you wonder why in the world is what you're doing not working, I'm going to give you the answer today, or a possibility as to why that is. So first of all, let's talk about the sciatic nerve. The sciatic nerve that comes out of your back and goes down your leg is actually made up of 5 nerve roots. Those nerve roots are L4, L5, S1, S2, and S3. These come together to form the sciatic nerve. So all of the YouTube stretches that you see and all the different things that people are doing to try to get rid of sciatica is focusing on an entrapment down here where this nerve comes together at in a muscle in your glute called the piriformis. Well, let me tell you, that can be an entrapment site, but you got a number of other options, at least 5 other possible answers or problems for where your pain may be coming from. And if this has not been evaluated here, then that may be why what you're doing is not working. Okay, so I'm going to talk to you about different things to look for and how can you tell the difference. First of all, okay, if you have pain, okay, that's coming out of the back, going down into the leg, if you feel pain up in the lower back or the upper glute, it's probably not coming from the piriformis muscle. Is probably coming from one of these nerve roots in your lower back. The most common possibilities that we see, L4, L5, and S1. All 3 of these can be affected by discs in your spine that are bulging or herniated or pressing in to the nerve. But also it can be affected because of the alignment of these lower 2 vertebrae or your sacrum. So if one of those is out of alignment, that can also irritate the nerve. And guess what? I don't care how long you stretch it. I don't care what you put a ball underneath there. You do all these different things. It won't give you relief because it's not dealing with the underlying problem. So you're going to have to get evaluated. If you've tried those other things and it hasn't worked, then we've got to look at these nerve roots up here and see if that's where the problem is coming from. To do that, we need to get an x-ray to look at your alignment of your spine. And we also need to look at the side to see the space that's occupied by the disc to see if the disc is wedged or bulging and putting pressure on the nerve. So I hope this helps you understand why, after having this for maybe weeks or even months, trying all the things that you tried, maybe that's why it hasn't gone away. So if you haven't been evaluated properly, give us a call. We'll look forward to seeing you. And also, if you want to know more about how to determine underlying problems and causes, click the subscribe bell so that you can get the next video that we do on this series. God bless and live life well.